Indian Prime Minister Narendra Modi has urged all citizens in that country to be vaccinated and exercise caution as the country set a global record for new COVID-19 infections in a single day. Over 354,000 new cases and over 2,800 new deaths were recorded in a single day.
U.S. President Joe Biden on Sunday said the United States stands ready to help India deal with a massive spike in coronavirus cases, noting that India helped Americans at the start of the health crisis. On Twitter, Biden said, quote, "Just as India sent assistance to the United States as our hospitals were strained early in the pandemic, we are determined to help India in its time of need." Earlier on Sunday, the White House said the U.S. will immediately provide raw materials to help India manufacture the Covishield vaccine, along with medical equipment and protective gear to help India respond to what has been billed a COVID tsunami. Washington said it would also send therapeutics, rapid diagnostic test kits, and ventilators. The U.S. was under mounting pressure to help India, where oxygen plants are being pushed to the brink. Indian Prime Minister Narendra Modi urged all citizens to be vaccinated and exercise caution as the country set a global record for new COVID-19 infections in a single day. U.S. officials are also actively considering sending India its unused doses of the AstraZeneca vaccine that have not yet been approved for use domestically, top U.S. infectious disease expert Dr. Anthony Fauci told ABC on Sunday. In India, time is of the essence, with a rate of one COVID-19 death in just under every 4 minutes in Delhi alone, as its underfunded healthcare system buckles.
And now for an update from India, we cross live to Ishan Garg. Ishan, good morning. And, very worrying news coming from India. But what is this latest upsurge in infections and deaths being attributed to?
Well, the officials are not entirely clear what led to this. There are a number of factors that they are attributing this spike in infections to. So first of all, there's this doubly mutated variant of the coronavirus that's feared to be highly infectious and is capable of reinfecting people as well. And on top of that, several experts are concerned that a number of public gatherings that have taken place in the past few months, where tens of thousands of people have attended political rallies as well as religious gatherings, those could have also contributed to this spike. And on top of that, there's also this sense of complacency and precaution fatigue that set in people when India defeated the first wave back in October. So one could see masks not being put on or social distancing not being maintained. And a combination of all these factors, according to experts, has led to the deadly second wave of infections that we are now seeing in India.
So, Ishan, what about these mutations and new variants as you speak about? Because the Serum Institute of India, for example, was at the forefront of vaccine rollouts at the end of the first wave, beginning of the second wave of coronavirus infections worldwide. So what is going on now in terms of your vaccination program in India?
Well, the government has approved a grant of more than $500 million for the Serum Institute of India and Bharat Biotech, which is an indigenous company developing a shot and has already rolled out a COVID-19 vaccine. So this financial assistance will be used to boost manufacturing of vaccines here in India, because the government is now opening up vaccinations for all adults in the country, and that amounts to about 950 million people. That's about 1 billion people who will be eligible for a vaccine starting next month. Now, the second challenge, of course, is to get more vaccines after ramping production domestically, and for that, the government has fast-tracked approval of vaccines that have been approved worldwide. So we are talking about the Pfizer vaccine, the Moderna vaccine, the Johnson & Johnson vaccine, vaccine that South Africa is also familiar with. So it's hoped that once all these vaccines hit the shelf, India will be in a much comfortable position. But the challenges of delivering shots to 1.2 billion people, or about a billion people, will be immense, because there will be a need for cold storage systems, cold transportation systems, and not only to urban centers like Delhi and Mumbai, but also to remote corners of the country in villages where sometimes one doesn't even find a road leading up to a public hospital.
So what is the plan right now from the Indian government and the Ministry of Health with regard to stopping what has now been dubbed a COVID tsunami in India?
The government's immediate plan for now is to open up vaccination, as I just said, and the hope is that that will help curb the infection. But secondly, and more importantly perhaps, is testing and contact tracing. In the past few weeks, several people have reported not being able to get access to a testing facility, and even though they are displaying symptoms of COVID-19 and could be potentially spreading it to others, they've not been able to test it for COVID-19, so they can't get the medical treatment, nor can they isolate themselves without having the confirmation. So that's something that the government is also working on. President Biden has approved in his arsenal of military medical equipment that's coming to India, fast testing kits as well. So that will be incredibly useful here in India. And on top of that, the government says that the immediate focus now is to fix the medical infrastructure. So oxygen supplies, that's concern number one. And for that, the government has approved a number of oxygen plants to be constructed in every single state that will help medical facilities with the shortage. And then we've got the government looking for oxygen from foreign countries as well. There's a tender that's been floated asking international companies to supply oxygen. Then pharmaceutical companies have also been tasked to create more drugs, potentially life-saving ones such as remdesivir, so that the country can come out of a shortage of those things as well. But experts are saying that what it really needs to do at this moment is impose strict restrictions on movement, so that the wave can at least be contained before steps are taken to cure people who've already got the infection.
Well, Ishan, thanks so much for that update. Our correspondent in India, Ishan Garg, giving us the latest update with regard to the COVID-19 situation there.